Welcome to this presentation on the organization and physical setup of the operation theater. We will discuss how an OT is classified, how it is designed, who staffs it, who forms the OT team, and the specialized responsibilities of the nurse in maintaining safety, sterility, and efficiency. The emphasis will be on principles, systems, and accountability, rather than only routine task lists. The operation theater is one of the most regulated areas in the hospital because patient safety depends on precise coordination and strict infection control. Its organization includes workflow design, personnel management, equipment readiness, and systems for documentation and waste disposal. A well-organized OT reduces surgical site infections, improves turnaround time, and supports predictable perioperative care. Operation theaters may be classified by function, specialty, and usage pattern. Major OTs handle complex and prolonged procedures, while minor OTs are used for shorter procedures under local or limited anesthesia. Specialty-based classification improves equipment planning, staffing, and infection control requirements because each surgical discipline has specific instruments, positioning needs, and anesthetic support. OT design is based on preventing contamination and supporting efficient movement of staff, patients, and materials. The layout should ideally separate clean zones from contaminated zones and allow a logical flow from reception to preparation, surgery, and recovery. Ventilation, illumination, and environmental control are essential because the physical environment directly affects asepsis, visibility, surgical comfort, and staff performance. A modern OT is commonly divided into functional zones. The protective zone is the outer access area, the clean zone contains support spaces, and the aseptic zone includes the operating room itself. Disposal and utility areas must be physically separated to prevent cross-contamination and to ensure safe movement of soiled materials, biomedical waste, and used instruments. Staffing in the OT is structured according to the caseload, complexity of surgery, and institutional policy. Nursing leadership coordinates schedules, inventory, infection control compliance, and interprofessional communication. In addition to the clinical team, technicians and support staff are essential for equipment preparation, cleaning, transfer, and maintenance of the OT environment. The OT team is multidisciplinary and highly interdependent. The surgeon and assistants perform the operation, the anesthesiologist ensures physiological stability, the scrub nurse manages the sterile field and instruments, and the circulating nurse coordinates the room, documentation, and supply chain. Recovery staff extend this care into the immediate post-operative phase, so the OT team should be understood as part of a broader perioperative continuum. The scrub nurse works within the sterile field and anticipates the surgeon's needs by preparing and passing instruments, sutures, and supplies. The circulating nurse remains outside the sterile field and manages documentation, patient identification, specimen handling, communication, and additional supply needs. Together, they reduce errors, support asepsis, and ensure that the procedure proceeds without avoidable interruption. The nurse's responsibilities span the full perioperative timeline. Before surgery, the nurse verifies patient identity, consent, surgical site, equipment readiness, and sterile supplies. During surgery, the nurse maintains aseptic technique, performs counts of needles and instruments, assists the team, and observes patient safety needs. After surgery, the nurse ensures safe transfer, complete documentation, specimen handling, and preparation of the OT for the next case. OT nursing is not limited to task execution. It also includes leadership, audit, policy compliance, and quality improvement. The nurse contributes to infection prevention surveillance, surgical safety checklist implementation, staff training, and equipment management. A strong OT nursing system combines technical skill with ethical accountability, critical thinking, and interprofessional collaboration.
Please like, share, and subscribe, and leave your questions as comments.